Good afternoon, everybody. Welcome to this session on the Digital Health Incentive Scheme. As you know, we have started it again from November 20th. So we have scheduled this meeting, although at a short notice, we informed you only on Friday. Uh, However, we will also hold another meeting maybe in this coming week, and we will also upload this recording on our website and also on YouTube, so that you would have access to whatever is being said in this presentation. इको हो रहा है. अच्छा, ठीक है, अभी भी हो रहा है. मुझे शेयरिंग राइट्स ही देना है. Only meeting organizers and presenters can share. I'll just share my screen and we will run through the provisions quickly. What was the thought process in having those provisions? After that, we will open the floor, and whatever questions you have, we will answer them. Is my screen visible to you? Okay, so we'll start. So the digital health scheme, as you asked, it has been started since January 2023. And give me one moment. This is echoing ना. उसका voice जो है ना. Sorry. So in this digital health incentive scheme, we have the hospitals, clinics, nursing homes, we have the pharmacies, we have the labs and imaging centers, and we have digital solution companies, same as what was there initially. Eligibility criteria is also the same. There is no change. And this is a good diagram which shows the comparison of the different provisions. As you can see, all public and private facilities, they have been, they are eligible under the old scheme also and the new scheme also. One big thing that has happened in this current scheme is that we have excluded scan and share services completely. So in this uh, in this DHIS, the in the focus is on incentivizing creation of digital health records. So we
सर
were
लोग
seeing.
बोल रहे हैं कि एको हो रहा है मैं
या तो उस वाले रूम में. Yeah, there was some echo from our side. So the intention was that the scan and share transactions were getting included, were getting done, and we were paying for the scan and share transactions in the modified policy. But now we have focused on uh, just incentivizing the creation of digital health records. And this is primarily done because scan and share is probably, we think now that the scan and share has now taken off very well, and now the focus is on incentivizing the next piece, which is creation of digital health records, making scan and pay transactions, and doing more consent based transactions, which I will come to uh, uh, a bit in some time. And then for health record linkage, what we have done is we want to promote KYC Aadhaar linkages, because many a times what is happening is that in various hospitals they are taking mobile number, they are creating Aadhaar addresses, and then they are creating records. But the point is that the lot of Aadhaar addresses are being made, and since it is not getting KYC, this concept of longitudinal health record, it is not being achieved. Therefore, we have although creation of non KYC health record is also possible now, but for digital health incentive scheme, we have focused on creation of KYC uh, health records. And in addition, what we have also done is that for the calculation of these KYC records, what we have done is that suppose we have given an illustration also in our corrigendum that if you create, say, a Ava address today is 24th November, we have given time till the calendar month. Like by 31st, if I get that Ava address KYC'd, then I can consider them and make you eligible under the DHIS. So if there are ABHA addresses, maybe the DSCs as well as the PHR apps, they can get in touch with the concerned person, and they can verify that health record, and then only it will be considered as a good health record linkage, and then only it will be considered uh, for DHIS. And the fourth win, which is a very important aspect of this DHIS, is that um, suppose I go to a hospital and the doctor asks for my previous records, and if the doctor asks my previous records, that means he will press the consent button, get previous records. And if I give the consents on my phone, then from wherever the health records are coming, each person or each entity from who is sending the records, we are paying them 5 rupees, and the person who is asking for the consent, we are giving 10 rupees. And that is why, since we have to promote interoperability, since we have to promote health exchange, this mechanism was thought wherein consent-based transactions are being incentivized, and this is a big thing in this year's DHIS. Maximum incentive limit. So, since the very important point that has to be noted is that this policy is not a new policy. It is like although on the table it says initial policy, modified policy, new policy, but it is all under the digital health incentive scheme. So it is, and that is why this corrigendum, you see, it is written corrigendum 6. It is not a new scheme. So suppose there are entities who have received 4 crores. Then from November onwards, we have increased this limit of 5 crores. So from November till March 26, that is for this calendar year, until till the time we have funds, we will be those entities who have taken 4 crore, they'll be eligible for 1 crore extra, and the maximum limit has been put up as 5 crore. And the utilization letters, this is applicable for public health facilities. The same clause that was there in the previous policy, which we have introduced in March 25, that within 9 months they will have to submit their utilization letters. Then only they will be considered uh, they'll be considered for the incentive. That is that clause is there. And for NHCX, the only change which is not written on this slide, but if you read the corrigendum, it is for the PMJY claims. So Pradhan Mantri Jan Arogya Yojana claims, if you send it through your HMIS, then 500 or 10% of the claim, whichever is low, you would get an incentive. The facility gets an incentive. Just for your knowledge, transaction, we have now put KYC Ava address. If you create a linked record to that KYC, that would be considered a transaction. Consent requests that are uh, granted by patients, as we had mentioned, it would also be considered as a transaction. and through UHI it will also be considered as transaction. And maximum of 1 transaction per day and 5 transactions per month, that clause is there. So it will be separately applicable for point number 1 and point number 2. So if I create, say example, if I create a health record, then I will get 20 rupees. And suppose during creation of that health record, if I access the previous person's record, then I will get uh, then I will get 10 more rupees. So this clause, this 20 rupees and 10 rupees, it is separate from each other. We will actually consider it as 30 rupees if I make a consent, and then um, if I make a consent, and uh, if I also create a KYC Ava address. Yeah, so we have updated our policy. Record linking, we have made it for KYC. Scan and share, we have excluded. Baseline transactions, we have kept it as 100. We have kept it as 100 only, because we want the facilities to do some work in order to get that incentive. And consent-based transactions, as you all know, we have given 10 rupees to the person, to the facility who is asking for those records, and 5 rupees for all entities who are sending those records. Um, Records generated through only KYC our address will be verified. Scan and share and health rocker we have removed. Baseline transactions has been retained as 100 transactions. Consent-based requests, like there are some auto-approve requests wherein if you sign on in a health locker, then there are some apps which are using auto-approve feature, and so that is not a consent in our opinion. Consent is something which is the doctor or the facility will ask. Then only those consents we will consider for the purposes of DHIS. And we have also mentioned in the corrigendum, if you see, that there are something which is called as scan and share of records. So what NHA is trying to do is uh, create a new use case wherein, if I like the way in which we use UPI, when we go to a juice wala and we pay him 10 rupees, then I scan the QR code. So right now also, if I go to a hospital, the intention is that the user will scan the QR code which is kept at the doctor's desk, and then they can decide which record to share, rather than the present method of pull. Uh, so that will also be considered in the scan, in this consent request based transactions when it will be launched. And scan and pay transactions will be incentivized, as I had mentioned. Claims for backdated transactions, the same clauses appear. We apply. You can claim up to till 3 months. So incentives can be claimed for a maximum of the last 3 months from the current month of claim submission. And we have also given an illustration that if I submit a claim in January, sorry, the slide, if I submit a claim in January 2025, then I can include backdated claim from October, November, and December, but not before October, that is September 2024 or earlier. Utilization letters, as I mentioned to you, there are the same clauses apply. If the incentives are less than 1 lakh, no need to submit a utilization letter. Incentives between 1 lakh and 50 lakhs, you would have to submit a utilization letter showing at least 25% of the funds that you have received should be used. And incentives which are greater than 50 lakhs, they should submit a utilization letter providing 75% utilization. This we have kept it because we want the public facilities to also utilize the funds. What we have seen is that there are various facilities which are claiming incentives, which are getting incentives, and the public facilities are not spending those incentives. They are just sitting on those funds. So we want to incentivize the public health facilities to use this funds. Otherwise, this or if you don't use the funds within 9 months from the last claim month, we will nullify your subsequent claims. This is DHIS registration. As you all know, the following are the are the documents which are required for registration. If the facility has already been registered, there is no separate registration which is required because it is continuation of the same scheme. Yeah, this is our email ID. We know that there has been a delay on our part in disbursing the incentives. Right now, we have disbursed till February 2025, and by this month, we will try to submit. We will try to pay off for March, April, May, and June, and then we follow these payment cycles so that we also know that the timeliness of providing DHIS incentives is very important, and we will try to make sure that these incentives are received on time. Also, for the month of November, since the corrigendum was issued from November 20th, so whatever transactions that are done from November 20th till November 30th, we will take into account, and we will also disburse incentives for the month of November. These are some of the screenshots which show that how does one facility register for a digital health incentive scheme. You have to log on into your HFR portal, register for DHIS, and then you have to submit these documents. You have to validate your Aadhaar, validate the Aadhaar number of the facility manager, and then you have to submit these details, and then give some undertakings, and then click. You have to e-sign that, and after you e-sign, you you will receive this template. And then how would you claim this? So your after you register, this is for the digital solution company, the same process. They will e-sign, and you can also claim from this button, which is the claim your incentive button on the left side. So similar process, I think most of you would already be aware, but some facilities which are not which are new, we will share this presentation and also this recording, and you can have a look at that, and make yourself aware. And if you are a public facility, then the state coordination team is there for you to assist you. If you are a private facility or a private integrator, you can get in touch with abdm.incentive@nha.gov.in, and we will organize regular webinars so that you are aware about the scheme, and if you have any clarifications, we may answer them. So the expenditure guidelines, this is just for the benefit of the public facilities. It is just for information that we have already issued these guidelines for utilization of incentives by public health facilities in February 2024, and there are various heads in which the public facilities can spend that money, and essentially it has been kept very flexible for public facilities to use this money. However, if there is any suggestion as to how do we even make it even better, more flexible, then we'll be very happy to listen to it and make even modifications. So this is it from our side, and I will stop my sharing, and then maybe you can raise your hands, and we can listen to your questions one by one. If eh, if if any person have any questions, you can raise your hands, and if after that, if there are some questions in the chat box, we will have a look, and we will answer them. So we will be here since as long as your questions are, and we will not close these sessions until everybody's question is answered. So anybody who wants to raise your hand, please go ahead and ask your question.
Thank you, Vikram sir. Thank you, Vikram sir, for the detailed presentation. I hope this new policy is clear to everyone. We'll take questions one by one. I can see Gaurav's hand is raised. Gaurav, I have unmuted you. You can ask your question. Gaurav Banerjee, you may ask your question. Okay, we'll go to Dhruvit. Dhruvit, you can ask your question now.
Sure, thank you. Good afternoon, Vikram sir.
Good afternoon.
Sir, let's say if HIU is getting record via scan and share method, which is done by the patient. In this case, how much the hospital will get and how much the digital solution provider will get in the new policy?
Digital solution provider is not being supported under the consent sharing. It is like if suppose let me give you an example. If suppose I go to AIIMS Delhi and that AIIMS Delhi software, the doctor clicks on that software, asks for records. Then if the records say come from Lal Path Lab, or if the records come from any community health center or from the PHC or from a small clinic, then those facilities will be given 5 rupees.
Okay.
And suppose if there could be also a possibility that those records are shared. I have stored themselves with my health locker. So health locker will also act as an HIP, and I will get 5 rupees for that transaction. So 10 rupees the HIU gets and 5 rupees each HIP gets.
Okay.
But this transaction, there is nothing for the digital solution company.
Okay. Even if the approval is given by the scan and share method, then also they will get the same amount, right?
Yes, yes. So if I go and I can scan a record, then the facility to which I am sharing, that gets 10 rupees because they have kept the QR codes and everything over there. They get 10 rupees. If I go to AIIMS Delhi, they have a QR code. I share my records through that scan and share functionality. AIIMS Delhi get 5 rupees, in 10 rupees, and like suppose I'm sharing it from my health locker, then the health locker is an HIP and I get share 5 rupees.
Right.
Yeah.
Okay. Thank you, sir.
Yeah.
Gaurav, you may ask your question now. I have again unmuted you.
No problem. I think Gaurav is rejoining again.
Okay, Dr. Anand Singh, you may ask your question.
गुड आफ्टरनून मैम।
जी गुड आफ्टरनून।
सौम्या मैम आप बोल रही हैं?
नहीं, मैं संगमित्रा बोल रही हूँ, बताइए।
गुड इवनिंग मैम। मैम फर्स्ट ऑफ ऑल मैं थैंक यू बोलना चाहूँगा, सच ए गुड प्रेजेंटेशन। मैं थोड़ा लेट जुड़ा मैम, एक्चुअली दो क्वेरीज हैं। एक तो ये जो सर ने पॉलिसी दी हैं, हम लोग लेट जुड़े तो देख नहीं पाए, तो इसको प्लीज अगर हो सके तो हम लोग को प्रोवाइड करवा दीजिएगा कि हम लोग डिटेल्स इसकी पढ़ लें।
ठीक है, आप वैसे वेबसाइट पे ही एबीडीएम की जो वेबसाइट है उसमें DHIS की पेज में जाके आप कॉरिजेंडम 6 अगर देखेंगे तो कॉरिजेंडम 6 में ही आपको ये पूरा पॉलिसी डॉक्यूमेंट मिल जाएगा। आप वहां से PDF डाउनलोड करके भी पढ़ सकते हैं।
ठीक है मैम। एक मैम सेकंड कंसर्न ये है कि हम लोग का पहले पता नहीं था। पहले तो हमारा यही था कि स्कैन एंड शेयर से हम जब इसको करते थे तो 20 रुपए पर कार्ड हमको मिलने थे। लेकिन हमको किसी ने भी ये नहीं बताया कि DHIS कैसे क्लेम करना है, क्या इसकी वो है। मैंने सौम्या मैम को मुझे लगता है 20-30 बार तो कॉल किया होगा, लेकिन कोई भी वहां से पॉजिटिव रिस्पॉन्स नहीं मिला मुझे स्टेट के लेवल से।
अभी आप कौन से मंथ की क्लेम की बात कर रहे हैं? अभी आप नवंबर ऑनवर्ड्स की बात कर रहे हैं कि मार्च से जून तक की बात कर रहे हैं?
मैम नवंबर ऑनवर्ड से बात कर रहा हूँ।
अच्छा, नवंबर ऑनवर्ड्स तो भी हम डेटा जब अपलोड करेंगे तब आप क्लेम कर पाएंगे। अभी आप मार्च से जून तक के क्लेम्स हैं, उनको आप अभी कर सकते हैं। वो
जो
आप कर
हमने
पा रहे हैं?
मैम सुन पा रहा हूँ, मार्च 2025 से लेके अब तक हमने जितने भी किए उसको हम
जी
क्लेम कर सकते हैं।
जी। हाँ हाँ, मार्च से जून तक का डेटा जो है सिस्टम, अभी हमने अभी रिसेंट हफ्ता भर पहले उसको दोबारा से अपलोड करा है, तो वो क्लेम्स आप अपने रेज कर सकते हैं।
ठीक है मैम, इसकी कोई लास्ट डेट भी है कि कब तक क्लेम कर सकते हैं हम?
आप जितना से जल्दी हो सके कर दीजिए।
ठीक है मैम, हमको अगर किसी की गाइडेंस की जरूरत पड़ेगी तो किसकी हेल्प ले सकते हैं? क्योंकि हमारे
आपको मैं
सीतापुर
या
डिस्ट्रिक्ट में
तो
अभी तक किसी ने भी क्लेम नहीं किया। मेरी सीएमएस मैम से भी बात हुई है डिस्ट्रिक्ट हॉस्पिटल के, इवन उनका भी क्लेम नहीं हुआ अभी तक कभी।
ओके ओके, आपको मैं अपना ये ईमेल आईडी चैट पे डाल रही हूँ, आप उस पे हमें रीच आउट कर सकते हैं, है ना? नहीं तो आप सौम्या के थ्रू भी रीच आउट कर सकते हैं। सौम्या मेरे पास क्वेरीज लेके जो है मुझे अक्सर अप्रोच करती रहती है।
मैम मैंने तो स्टार्टिंग में बोला कि सौम्या मैम की तरफ से मुझे कोई भी पॉजिटिव रिस्पॉन्स ही नहीं मिला। मैंने अभी सैटरडे को 4 बार कॉल की है तो कोई रिस्पॉन्स नहीं था मैम, सॉरी टू से, बट अनफॉर्चुनेटली स्टेट से मुझे कोई पॉजिटिव रिस्पॉन्स नहीं मिलता है कि कोई हेल्प करे हमारी।
अच्छा, आपको मैं ईमेल आईडी जो है चैट पे डाल दे रही हूँ, आप उस पर रीच आउट कर सकते हैं।
थैंक यू सो मच मैम।
Okay, we'll move to next question. Sam Dennis.
Hello, sir. We are from Eka Care. So, sir, one question we had was, let's say, for patient-initiated scan and share of records, how does the consent get? Let's say, for example, sir, from if we are sharing records that are from our health locker, or there is a subscription created, how does the HIP know that this is getting pulled from a subscription or from scan and share or from consent initiated from the doctor side? Because let's say because the subscription model is not incentivized, is there any sort of a method where we can track where the consent is coming from, sir, or the method of consent created? So you are on.
Sir,
You are muted.
sir, I think आप mute पे हैं, sir.
Yeah. Is it audible now?
Yes, sir. Yes.
So the scan and share of records, first of all, Sam, it has not been rolled out. So when it is rolled out, we will give detailed guidelines about it. So please have patience on that. But in very brief, scan and share of records, if I am doing it from my from my PHR app, then the fact that I am scanning the QR code means that I am providing the consent, and HIU is the person to which I am putting the records. So if I am scanning AIMS Delhi's QR code, then AIMS Delhi get 10 rupees, and if I am say giving all the records, sharing all the records from my health locker, so my health locker becomes the HIP and I get 5 rupees. However, if I have not stored it in my locker, but I am just providing the links of my HIPs, then though they will also get the 5 rupees.
Okay, sir. But in case of, let's say, there's another health locker that has a subscription pull where they are auto-generating or relinking records that are linked to a patient's ABA. In that case, as let's say a health locker ourselves or a HIP of any sort in one of our facilities, they wouldn't know that the consent is auto-approved or anything. So in that case, is the HIP incentivized?
No, only from that, if those records are going from that PHR app, so that if they go from your PHR app, then they will be incentivized and not the other app.
Correct,
Might,
sir. Sorry, sir. The question for me, I think, is let's say if there is a auto approval consent that is getting generated from any health locker, and I as a HIP provide the records, will I get any incentive, sir?
Yeah, provided that you are providing it to some other HIU. Auto approve doesn't mean that if the record just comes in your PHR app, it lands there, you will not get any money. In that in that transaction. But if the records which are auto approved, but they have been downloaded in your health locker, but subsequently you transfer it to another entity, then you will be rewarded.
Okay, sir. Okay.
Just to be sure, so the HIU that we are talking about, even if this is another PHR app, it doesn't really matter because we are the HIP providing the records. It's still counted as an
Eligible transaction.
eligible for it. Got it.
Sir, and one last question I had was regarding the limits for each transaction. So the corrigendum mentioned that there is a separate limit for linking based records, incentives, and pulling based incentives. So how do those limits exactly work? Because I felt there was a little bit of confusion, because at the end there was a separate mention of limits, and in each illustration there was a limit separation. So
Yeah. So if you see, we have tried to give try to share it with you in this. In there is a note. If you see, only one unique ABHA per day and 5 per month will be considered for payments related to the PHR app. This restriction of 1 ABHA per day and 5 ABHA per month will be separate for record linking and consent-based incentives. So these 1 ABHA per day and 5 ABHA per month, this is separate for you say for consent-based incentives, and for record linking it is separate. So suppose I take the example of AIIMS Delhi again. So I go to AIIMS Delhi, the doctor asks me and he asks me consent. So when the doctor asks me consent, the AIIMS Delhi get 10 rupees, and suppose the facilities, 2 facilities, Lal Path Lab and a PHC where my record has come, they get 5 rupees each. Now after seeing those records, AIIMS Delhi doctor now creates a digital record that is KYC ABHA linked. For that particular transaction, AIIMS Delhi gets 20 rupees more, and the software which AIIMS Delhi is using, the HMIS which AIIMS Delhi is using, they get 5 rupees.
understood, sir.
So it's like 2 transactions are eligible, which are distinct transactions.
Yes.
They are eligible for it.
Yes.
Like, let's say if there was another transaction like UHI, possibly, then that also would have been incentivized.
Sir, yeah, those would be separate.
Yes, separate.
Each category.
Sir, just a request I think might be echoed is, sir, if there could be some sort of an incentivization for M3 being done from the DSC, that could also be helpful, sir, because we are enabling it for the patients, and a lot of that is not taken into consideration. So
you send an email justifying why it is needed and how it may be provided.
sure, sir. Thank you.
Sir, there is one good question which has come from Atish. He's mentioning that our primary patients are newborns and pediatric patients. They don't have Aadhaar cards. How to go about it?
There is this concept of creating Bal Aadhaar. So you can still create the ABHA numbers if they have Aadhaar, and it will be considered as a valid transaction. And also, like as I mentioned to you, it is at the end of the month. So suppose a newborn comes in this month, but comes on 1st or 5th of the month. But by 31st, if they get Aadhaar, then you will be considered KYC'd ABHA. So pediatrist, you might face a bit of challenge, but that is the intention is that we will promote KYC transactions only.
Good afternoon, sir.
HMIS Ladakh.
Can I speak, ma'am?
Okay, go ahead, please.
Sir, most of our patients, they'll come, say, at 1 month or 1.5 months, and then they won't come for six months. and their Aadhaar cards are all created after 2 years, 3 years, and parents are really circumspect about sharing their kids' Aadhaar card. So there are 2 to 3 factors which play out strongly here. So that way. So if there is any way we can address that, because of that, our primary doctors who are using, they're all pediatricians. So we lose out on a big database.
You send us an email sharing your situation. There are some things which we can point you to where they can also create Aadhaar from their parents' Aadhaar. That is called Bal Aadhaar, but it can be created only through some designated portals. So we will share that information, and if there is any situation you want to mention in your email that this should be exempted, you please give us a detailed note as to how can it be done. The fact is, whenever we try to relax something, it gets misused. So we also have to be, I do understand the challenges that you are mentioning, and maybe some of the challenges that you are mentioning are true also. But if you see it from a systemic level, from my level, then it gets difficult. But please send us an email. Let us have a look at that separately. And we can also see whether how we can address your situation.
So can you hear me, sir?
What do our patients do? I'll tell you, sir. What do our doctors do? They take
you send us separately, Atish.
Yeah, they put the parents' email Aadhaar card. So that again goes wrong. You understand?
Yeah, but parents' Aadhaar card se bhi we can create the kids' Aadhaar card. We will share you that workflow. However, that workflow is there only with some designated portals. So we will share those portals details also with you, and we can separately see whether it solves your problem or not. Okay.
Thank you, sir. Thanks.
Yeah.
Can you hear me, sir? Hello.
Yeah, please.
Yes, sir. I'm
Yes,
Finlay, sir,
yes.
from Ladakh, and my query or suggestion related to the notification when the money is dispersed from the NHS side. So many of the times, the notification on the recipient list or the dashboard that is provided within the NHA HPR login, it's not sufficient enough, sir. That creates that sometimes some money is credited in account a month before, but hospitals are still not aware that money has been credited. So can we make it more UI notification based, so we can get alerts when the amount is going to be knocked off, or a notification system where the money has been credited. Yes, sir.
So you mean to say that I mean, as I understand, you are trying to mention two things. First is you are trying to say that if the amount is going to be knocked off, at least the facility and the state gets a notification that this is going to be knocked off, so that they can make efforts to make sure that that amount does not get nullified. I think that is a valid point, and we will try to incorporate that by sending emails, auto emails, or by sending maybe manual emails from the very starting. And second thing was that if a facility gets an incentive, they should be informed, right?
So there are already dashboard setups in the NHA official website. One is called recipient list, and another is the HPR login by
Yes.
which we are claiming. But sir, that still it lacks a responsiveness, sir, because many of the times the data is not correctly depicted, or sometimes the API is not working there. So yes, sir. And the
सर कुछ
transition
इंस्टेंसेस में UTR नंबर is right. एंड सर ईमेल पे मैं एक स्टेट से भी रिक्वेस्ट चाहूंगी कि मोस्टली जो फैसिलिटी मैनेजर्स दे लीव द हॉस्पिटल्स, दे डोंट अपडेट देयर HFR ID, आई मीन द credentials, they don't hand it over to the next manager. So most of the times the email ID which we have doesn't exist anymore. सो ये एक बहुत बड़ा चैलेंज NHA के लिए भी रहता है कि जब भी हम रीच आउट करना चाहते हैं, लाइक थिनले आई नो यू पर्सनली सो आई कैन रीच आउट टू यू, बट बहुत सारे मैनेजर्स ऐसे होंगे जिनको आई एम नॉट एबल टू रीच आउट ओनली. सो ये भी एक स्टेट की तरफ से मेरा रिक्वेस्ट है स्टेट्स के लिए कि वो अपना प्लीज, जब भी कोई नया मैनेजर ज्वाइन करता है वो प्लीज अपने जो ईमेल आईडी और कॉन्टैक्ट नंबर है वो अपडेट कर दें, या फिर कोई ऐसा नंबर रख दें जो कभी चेंज ना होए, जो पर्सनल नंबर ना हो किसी का या पर्सनल आईडी ना हो किसी का.
Yeah, these are some troubles, but and this is where the role of state coordination is important, so that the state coordination division at NHA as well as the state mission director at the state, they should be in contact with each other, so that all these information mismatch doesn't
Yes.
happen.
Yes, so one of the incident happened in the month of January. So the UC was sent on the proper date and time also, but due to the miscommunication or due to the UC being not reached there at NHA properly, that amount was knocked off. So we could please request you, sir, please to have look on that knock off transaction, sir, please.
Okay. Yeah.
Dr. John, you may ask your question, Dr. Khairum John.
Ma'am, thank you,
Okay,
ma'am.
Lakshman, you. Okay,
Hello,
okay,
ma'am.
please go ahead.
Ma'am, regarding sir our Manipur state, uh, we are only our public facilities, health facilities are only earning DHIS from scan and share. So clinical module has not been activated. Yeah, even though it's activated due to some technical, due to some problem with the human resource or due to the NIC, we are not able to. We have been trying to implement this clinical module very much, but some district they don't have even like some districts their lack of computer and all, even though they have for this only for ticketing they have, but inside there are so many departments and all, they are putting those proposal in the procurement and it's in process, sir. So like our state's public facilities won't be getting any DHIS with regards to the new policy. So is there any relaxation and all, because ours have already only started because of the net ban and all, sir. We are a little bit slow behind our state due to the freaking this net banning and coming in some problem going in our state and all. So sir, is there any relaxation for our state Manipur regarding, if possible, only scan and share that the transaction 10 rupees was okay, but that also complained by this the medical superintendent MS and all, that too less to be given to the DEOs to which they hire, no sir. So like it was escalated like this, sir, and some issues regarding this one. But thank you for so much for opening this scheme again. But to give benefit to our public sector, if possible, sir, could you please help our state like lagging behind, like regarding if you able to pay scan share, uh, at least like for even big hospital also they are putting under procurement and all, they are not getting their computers and all, still state has some issues, and even district hospitals they are lacking in the infrastructure. And sir, these are the issues, and more, sir, and one more issue, sir. Our state, the big one of the biggest hospital, Zenims, they are doing very well in scan and share. Almost everything is converted into scan and share, sir. They don't take this offline and all, but only through Abha only they are doing. So, but we are not able to claim those incentive because it's not visible in the ICFR's DHIS claim portal. We're not able to visible. It has been also escalated from our grievance portal also. sir, I'm putting this, sir, regarding. Thank you, sir.
So Manipur, what we can do is that we can work alongside the NIC team to make sure that the OPD module or the record creation module uh, is up and running in your state. So I'm not sure whether we'll be able to provide you exemption because it's a scheme wherein we want to promote, we want to go to the next level. And if there are challenges in Manipur, as you had mentioned, I do understand those challenges, but the easiest thing for us and for you also would be to push NIC to give that module, and then we can also internally take up with your Secretary of Health and your MD NHM that the hardware related challenges can be addressed. So you can send a formal letter to us stating that in detail the issues, and then we can discuss and try to sort it out.
Thank you, sir.
Yeah. And with regard to March, April, May, June, I think Sangamitra, can you help on this as to why their claims are not visible?
Yes, sir. Sure, sir. I'll do that.
ठीक है. You get in touch with Sangamitra.
Yes, sir. Thank you, sir. Thank you, ma'am.
Thank you. Thank you. Lakshman, you may ask your question.
Yeah, thanks. Hi, Vikram sir. I'm Lakshman. I'm from a healthcare service industry. We have dialysis centers across India. So many of them are registered on your DHIS portal. So one of the issues my team faces whenever they are registering a new facility under this program. Earlier also we had talked about this in the previous meetings. So the addresses which are there, which are required for a approval of the entity, varies in terms of what address proof we have and what are the district or all the uh, taluk level, what website is your portal is considering varies with the actual address of the facility, and many of times rejection is there. And as we are a third party provider uh, of dialysis services, we don't have a brand photo or something like that because that is not there in tie-up. If suppose we open in a corporate hospital, we don't showcase our name. So even then, the local health officer rejects our facility saying that you are not uploading the photograph and of so and so. So that is one of the problem we are facing. And apart from that, as we have many facilities, it will be really helpful if on the portal itself we can get the list of or Excel file or anything of the centers which are currently eligible for the claiming incentives. Because otherwise my team goes on logging into each and every uh, facility and tries to claim those facility. But many a times those some facility uploads records, some has nil amount of records. So that takes lot of time for my team. And whenever we receive the payment, uh, so it gets credited to the account, our company account, but then AR team reconciles it and try to understand from where the payment come. And we cannot tie up to the different cost center, whereas we get a total sum and do not understand from which exact ID we are getting payment. Like suppose we are getting 1 lakh, 10,000 from Jharkhand ID, 10,000 from Mumbai ID. So at the company level, that becomes a bit issue for us to understand how many records we actually uploaded from each facility and how much incentive we are getting from each facility. Yeah, that's all, sir.
So Lakshman, third question first. Sangamitra, we give this report,
Sir,
right?
सर हम रेसिपिएंट लिस्ट जो है अपडेट करते हैं टाइम टू टाइम. लक्ष्मण, आप रेसिपिएंट लिस्ट के बारे में आर यू अवेयर?
No, we actually, our DSC partner used to submit us the list, but post Feb, we were not able to get the list.
Yeah, post Feb, you have
Okay.
not been able to get the list because March, April, May, June incentives, they are being processed right now. We had some trouble in getting internal approvals for the scheme and the budget and all. Now those have been resolved, so those you will shortly get from February onwards. You will have a look. And for
सर
the
मैं एक बार रेसिपिएंट लिस्ट एक बार इनको दिखा दूं, एक बार अपना स्क्रीन शेयर करके.
yes, so it will be helpful for all of us.
So जो रेसिपिएंट लिस्ट है, I'll just share my screen.
If you are facing issues, I can also share.
Sir, I'll just try, sir. I hope मेरी screen visible है अभी.
Yes,
Yes.
it is visible.
So आप वेबसाइट पे जाएंगे abdm.gov.in पे. यहाँ पे इनिशिएटिव्स का एक टैब है. In that tab, you will see Digital Health Incentive Scheme. You click on that. So all the scheme documents you can see here. There is one tab called recipient list just next to operational guidelines. Right now, we have not updated the recipient list, but we'll update it in the coming week of the payments which have been made recently. And here you will see a note. You can just click here to view the summary of month-wise payments successfully dispersed to facilities. You can also type your HFR ID and search. Additionally, to download the complete Excel, you can just click here. And then you can just so this way you can search your facility and you can also status of the payment. It is under process or is it not due to some reason. There are different drop down categories here of the payment status. Plus state wise filter also is there. You can also know about your state, and district wise filter also has been made here. Plus the claim submission date, whenever the claim was submitted, the date also comes here. I hope this is clear. We'll update this list very soon. Maybe in the next 2-3 days we'll get this updated, and then the latest payments which have been done for your facility.
Understood. Yes, thank you. Yeah.
And regarding that, your HFR, because of that building picture is not there, can you write to us separately, sharing the reasons as to why you don't have the picture? Because picture is something which is very, although it is not a mandatory field, but it is something which is very obvious, right? To give the name of the facility. But I will, you send an email to us. We will
Sure, sir.
forward it to our HFR team and we will schedule a call. And if there is anything that is required, if the state has to be told to not reject those facilities, we will even do that. So we will have a conversation with the state, because nowhere in our SOP we have written that having a picture is mandatory. So you share that email and we'll try to sort it out.
Sure.
Lakshman,
Facility
I
board
have
is
put in.
mostly yeah. Yes, sorry. Yeah.
Sorry. Go ahead.
Yeah, facility board is the issue. Suppose I tie up with XYZ corporate hospital, they don't allow us to put our facility board, and that causes a issue.
You say that, then you ask that facility to register it in their name itself, na?
But we are the owner of the documents, right? As a dialysis provider, they are our dialysis patient, and we are owner of their medical documents, not the hospital partner.
No. But the place where you provide dialysis, it belongs to you or it belongs to them?
It belongs to us, and it is registered under GST to us only. But as a MOU, we operate under their hospital. We don't do branding.
You share your specific use case with us. We will see.
Sure.
Lakshman, I have put in the email ID of our HFR team also on the chat.
Got it. Yes. Thank you, Vikram sir. Yeah.
Rahul Tripathi, HMIS expert. Okay, Sabita Suryapet, you may ask your question.
Good afternoon, madam. Good afternoon, sir.
Good afternoon.
Sir,
Ji, good
actually, I claimed the previous month also, that is in the October 2024, from October 2024 to February 2025. But the transaction amount was showing, the claim amount was zero. It's showing. Already I claimed on the online only. I sent the proof document to the Amit sir. But
Okay.
it's the DHIS and the HFR portal, it's showing the amount was zero.
Okay. संगमित्रा.
Okay, आपने अमित को कंसर्न रेज किया है, आपने ईमेल पे किया है?
So
Sorry,
have
have you
okay, hi
raised this
Sanghmitra,
concern?
I'm at this side. Hi Sanghmitra, I'm at this side.
Hi Amit, we can hear you.
Right. So she has raised the concern with the screenshot and all the valid things. We need to check why it is zero. Maybe the records are zero or something like that. We need to find that. So please hold on for few days. We'll get back to you on this query. We have all the inputs from your side.
Okay.
Okay, sir. I can wait.
Okay.
Mohit sir, from UP.
सर गुड आफ्टरनून।
Good
सर
afternoon,
कुछ
Mohit.
चीजें थी सर, हमारे यहाँ क्लेम बहुत लंबे लंबे बचे हुए हैं सर। किसी की फरवरी 24 से बचा है, किसी का वो बचा। क्लेम तभी हुआ था सर, तो क्या उसका तरीका होगा, मतलब इस समय क्लेम करने का सर? क्योंकि काफी लंबा टाइम बीत गया और क्लेम सबने किया भी था सर।
क्लेम उन्होंने रेज किए हैं?
जी सर, क्लेम रेज हुए हैं सर।
क्लेम कब रेज हुए हैं? फरवरी 24
सर उसी समय जब वो मिला उसको रेज किया गया, लेकिन सर पेमेंट आए नहीं। और ज्यादातर हॉस्पिटल, जितने हमारे बड़े अस्पताल हैं, लगभग सब में ये दिक्कत है। लोक बंधु में जैसे 24 से नहीं आया, फरवरी 24 से नहीं आया, सितंबर 24 से जो है यूएचएम में नहीं आया है सर।
सर
ये दो
आपके
तो अभी
कुछ
सामने
क्लेम्स जो है
बैठे हैं।
नलिफाई भी हुए थे, आपने सर आपके कुछ क्लेम्स नलिफाई भी हुए थे कुछ फैसिलिटीज के ना?
नहीं, नलिफाई कैसे
आपको मैं
हुए थे?
एक लिस्ट आपको मैं जो है कंपाइल करके भेज सकती हूँ।
मेरा
और अभी
नॉकऑफ
काफी पे भी।
हाँ बताइए।
सर एक लिस्ट आपको कंपाइल करके जो है यूपी की, आई कैन सेंड इट टू यू, आप उसमें एक बार चेक कर सकते हैं। काफियों के नॉक ऑफ भी हुए हैं सर, और काफियों के पे भी हुए हैं अभी
नहीं,
रिसेंटली।
नॉकऑफ क्यों होगा
सर नॉक ऑफ के रीजंस बहुत सारे सकते हैं सर, जैसे यूटिलाइजेशन जो है आया ही नहीं होगा,
यूसी
या
कभी
फिर
कंडीशन में नहीं था।
मार्च
सर
2000
यूसी वाज नेवर इन कंडीशन।
सर यूसी
से यूसी
No,
कंडीशन
it was never. It is not written in any of the GO.
नहीं, it is
The
written
UC is mandatory for giving the incentive, because UC has nothing to do with the incentive.
मार्च
नहीं सर
2020
सर मार्च से सर शुरू है, मार्च की पॉलिसी में क्लियरली लिखा है सर।
उससे पहले से क्लेम डालो।
नहीं, तो उसके पहले के जो उस समय क्लेम था, पैसा नहीं था, नहीं रिलीज हुआ, तो वो थोड़ा ही नॉक ऑफ होगा ना। चलिए फिलहाल आप लिस्ट भेजिए।
मोहित एक बार
हम
डिस्कस कर लेते हैं इसको।
ठीक है सर, इसको फिर से कर लेते हैं सर। जी सर।
तभी तुम्हारा नाम जो क्लेम।
गौरव
रिंजिन, आप यू कैन आस्क योर क्वेश्चन रिंजिन।
Hello.
Hello.
Hello, sir. Can you hear me?
Yes.
Okay. Sir, while talking about this NHCX, you mentioned कि PMJY claims जो HMIs के through होते हैं, उसका भी incentive होता है, if I'm not wrong, right?
Yes.
So that HMIs, what you're mentioning, is it regarding like जब हम जो HMIs use कर रहे हैं वो next gen है, तो उसके थ्रू भी is there a process to claim those incentive?
सो अभी वो एबीडीएम कंप्लायंट है रिग्जिन, अभी हमको उसको एनएचसीएक्स कंप्लायंट भी होना पड़ेगा। तो अगर आप मतलब हमारे उस पे जाएंगे वेबसाइट पे, तो हमारे पास जैसे यहाँ पार्टनर्स पेज पे अगर मैं अपनी स्क्रीन शेयर किया हूँ, इसमें पार्टनर्स पेज में आवर पार्टनर्स हैं। तो अभी एनएचसीएक्स के अंदर ये इतने सारे ये जो डिजिटल सॉल्यूशंस कंपनीज हैं, अभी इनके सॉफ्टवेयर हैं। अभी एनआईसी और सीडैक वाले जो लोग हैं वो एनएचसीएक्स से इंटीग्रेट कर रहे हैं। तो एनएचसीएक्स से जब वो इंटीग्रेट कर लेंगे, तब फिर अगर आप इन सब सॉफ्टवेयर्स को यूज करके आप वो क्लेम अगर डालेंगी, वो हॉस्पिटल डालेगा, तो उस हॉस्पिटल को पेमेंट जो है 500 रुपीज और 10% ऑफ द क्लेम विच एवर इज लेस वो मिलेगा। तो प्रेजेंटली नेक्स्ट जेन को नहीं मिलेगा, क्योंकि नेक्स्ट जेन एनएचसीएक्स के साथ अभी इंटीग्रेटेड नहीं है।
Okay, okay, sir. And
बट वी आर आफ्टर एनआईसी कि वो जल्दी से ऐसा कर ले।
ओके ओके सर। और संगमित्रा मैम, आपसे मेरी मतलब व्हाट्सएप पे बात हुई थी रिगार्डिंग सांकू
जी जी
HCA।
हाँ, मैंने आपको अपडेट डाला था उसका, एक बार आप चेक कर लीजिए।
हाँ मैम, मैंने वो देखा एंड उसमें आपने लिखा है कि मार्च 25 में जो है वो नलीफाई हो गया है।
जी जी, क्योंकि मार्च में पॉलिसी चेंज हुई थी ना। आपने अगर कोई क्लेम मार्च में रेज किया होगा तो उस जो अपडेटेड पॉलिसी के अकॉर्डिंग जो क्लेम्स थे वो नलीफाई हो गए। लेकिन आपका जो फेब वाला क्लेम है वो जो है वो इन ट्रांजिट है, वो जल्दी ही आपका जो है डिसबर्स हो जाएगा।
ये दोनों हॉस्पिटल्स ने ना मैम अलग अलग टाइम मतलब मंथ में बहुत सारे सबमिट किए हुए क्लेम्स, जो मैंने आपको स्क्रीनशॉट भेजा है। कैन वी हैव अ डिस्कशन
Okay.
आफ्टर दिस कॉल रिगार्डिंग दैट?
एक बार फिर इंजन, एक बार इसको हम सेपरेटली एक बार कॉल कर लेंगे, है ना?
Okay, ma'am. And district hospital Kargil का this I have raised it many times, even मेल पे भी I think ABDM के मेल से भी आया होगा। नॉक ऑफ हुआ है अराउंड 4 to 5 months का, जो as per our understanding वो उसमें मतलब गाइडलाइंस के हिसाब से क्लेम टाइम पे सबमिट हुआ है। स्टिल it has been knocked off। उसका भी कुछ रिप्लाई अगर दे सके तो, क्योंकि
कारगिल का वैसे हम लोगों ने रिप्लाई किया था। हाँ सर, इनका वही नॉकड ऑफ वाला ही है क्लेम, कारगिल वाला भी ना। जो एक्चुअली इनके यूसी 2 लॉट में आए थे, तो जब तक वो यूसी हमने रिकंसाइल नहीं किया, तब तक पॉलिसी अकॉर्डिंग इनका नॉक ऑफ हो रहा था। तो ये रीजन था इनका सर। ठीक है रिंजन, विल टेक दिस सेपरेटली इन अ कॉल, है ना?
That's why, sir, we were asking about that. There should be a warning system for all the facilities that you have claims gonna be knocked off और होने वाला है करके। तो क्योंकि we send our UC on time, but due to the miscommunication and the delay sending from the state to the coordinator to the NHA, I think there's been a huge miscommunication gap. तो उसको avoid करने के लिए मैम।
I remember this case, right? We can take it separately. Okay. So I remember when the second one came, so cutoff we already took and that was not considered. But anyways, let me and Sanghmitra again go through it and we can let you know if there is any further steps on it.
Okay. Gaurav, you can ask your question. Gaurav Banerjee.
Am I audible?
Yes.
Yes. Now, actually, my mic is not working for some times. Actually, my question is, I have registered DHIS claim for West Bengal for at most 40 facilities, and on that 6 facilities has claim submitted successfully after their approval. But other than that, all the facilities are pending with the approval, so they can't claim their incentive. Approval are pending. All for all 34
So
facilities.
Gaurav, you have shared this list with Vaibhav, right?
Yes, Vaibhav has already shared that list with NHI also. But what happened that time? DHIS has been closed,
Okay.
and so it was pending. Now, when it is opened again, now problem is
Okay.
the problem exists is same that the approval is still pending. This is the main problem we are facing.
All
At
right.
most,
So Gaurav,
30.
can you
Yes.
please send this list again? We'll expedite this.
Okay, sure. I will send it to you. And another thing I have a question. Our DSC claim from West Bengal Health is pending till now. But I have a question that for DHIS claim, we have a government facility list and we have a private facility list. For DSC claim, we have to fill both of them, or we have to fill any one of them.
You are a DSC.
No, I am asking that for when we are claiming for any DHIS claim, for government facilities, they are only filling the annexure for government facilities. There is two options. And when DSC claim we are claiming, there is also two options. When for the DSC, it is for the entire state. So we have to fill private and government both, or we have to fill the government only. This is my question only.
Are you talking about the annexure form? Annexure
Yes.
form 4.
Yes.
So if it is a private entity, they can fill in that. And if it is a government entity, they can accordingly choose that option only.
No, for DSC I am asking, not for DHIS I am asking. DHIS I know that when the government entity is applying for the DHIS registration, they will fill the government form only. For the private facility, they will form the private only. But for the DSC,
So
will they fill up both of them? Because DSC is for the entire state.
no, but
Digital
DSC
solution.
as such.
Okay. For
DSC.
claiming, right? So the process is initiated via us, right? So we are
Yes.
still doing it in a manual mode. So what we do is we collate all the information and we send it to the DSC with all the transactions and related details. So it is initiated by us only. It is not initiated by the DSC. We initiate and they sign it and send it back to us.
No, I understand. But if when I'm going to filling the DSC form, I have to again fill the mandatory form for
You are trying
bank
to
mandate.
Okay,
Yes.
you're trying to register the DSC or you are trying to claim for a DSC?
Amit, he's
I
trying
am
to register it.
Register the DSC for West Bengal
Okay.
Health, I am telling.
Is your DSC also used in private facilities?
Yes, it is also used because state is West Bengal, so private and government both are used there. That's why I'm asking you.
But irrespective, right? So it will get the incentives for both, like other cases we have. So you have to register as per DSC. It's a private or a public. That's it.
Okay, no issues. Okay.
Yeah.
Thank you.
Okay.
Now it is clear. I will send the mail to you as per your requirement.
Yes.
That
Yes,
list of hospitals. Okay.
Yeah.
Rahul Chanda, you may ask your question.
Am I audible, madam?
Yes.
सर गुड आफ्टरनून सर एक्चुअली दो दिन कॉन्सर्न था फर्स्ट ऑफ ऑल सर जैसे हम लोग का डैशबोर्ड में हेल्थ रिकॉर्ड लिंक का जो डेटा दिखाता है सर उसमें सर देयर आर सम सो मेनी क्वेरीज एक्चुअली बिकॉज इट विल आल्सो डिस्प्ले द स्कैन एंड शेयर रिकॉर्ड्स आल्सो सो इज देयर एनी मतलब आप लोग आइडेंटिफाई कर पाएंगे उसमें अगर कहाँ से रिकॉर्ड आया है सर आइदर स्कैन एंड शेयर और द इंसेंटिव बेस्ड रिकॉर्ड दैट विल बी बेटर फॉर अस टू आइडेंटिफाई वन ऑफ द थिंग. And one more thing, sir, e-Sanjeevani, it is also incentivize the facilities with the use of e-Sanjeevani?
E-Sanjeevani, presently we are not doing under DHIS for public this thing for virtual portals. But now that e-Sanjeevani has come at a facility level whether we can incentivize for e-Sanjeevani transactions, we will get back to you, because till now what used to happen is that e-Sanjeevani we didn't know where the records are coming from, and recently
Yes.
only e-Sanjeevani has started making available health facility information also. So whether we can make you a part and consider them under DHIS, let me just have a look at it and get back. You send us a small email, uh, because then it will become on record and we will try to provide that. And the first question that you asked, that you want a view as to how many scan and share transaction, how many health record transactions, so that you have an overview as to how many transactions are being done.
Yes, sir.
Okay.
And sir, one more.
Let us
Suppose
that
sir.
how do we get that done? Yeah.
एक्चुअली सर और एक चीज है सर कि जैसे हम लोग का अभी पीएमजीओआई का इंसेंटिव आप बोल रहे हो कि 500 रुपीज, बट इट इज एनएससीएक्स एनेबल ओनली. सो राइट नाउ वी आर यूजिंग द ई हॉस्पिटल. सो अभी हम लोग क्या स्टेट में प्रमोट करेंगे क्या इसको, पीएमजीओआई को, कि इंसेंटिवाइज कर सर?
ई हॉस्पिटल के साथ एंड सीडैक के साथ वी आर वर्किंग ऑन अ मिशन मोड, and we have raised it to the DG NIC as well as to the DG CDAC, that they should get their software integrated with NHCX. The trouble with the NIC and CDAC is that they do not have a claim module. So that development also has to be done. So it will take some time for NIC and CDAC to get integrated with NHCX. But if they get integrated with NHCX, which is what we are trying to do, then they can send claims from their HMIS to NHCX claims through the HMIS directly, and then we can give them 500 rupees those facilities for utilizing for under the DHIS scheme. Secondly, what we are also trying to do is that PMJY hospitals, they also get like, anyways, most of the treatments in government hospitals which are also empaneled under PMJY, it is free only, right? But when they do PMJY procedures, they get some money. So that money can also be used for ABDM. We are issuing a separate circular so that the public facilities, they don't face problem of fund shortage in, like, if they want to do ABDM adoption. So we are pursuing that, and very soon we will share that circular also.
ओके सर. सो देन अभी हम लोग इसको प्रमोट थोड़ा मतलब कर सकते हैं या?
हाँ, एक बार दिसंबर 15 तक let's try to get it integrated, and then you can keep your plans prepared.
Okay sir. Okay sir. Thank you sir.
Plus 21 is also getting integrated. So Bihar, Tripura, if you want to use that also for NHCS claims, you can use that.
Okay sir.
On Dhruvit, Dhruvit, you have another question?
Yeah, a small question, sir. So we have integrated blood bank service for PHR and PMJY enabled hospital that also user can find from our PHR application. So I guess both are part of UHI. So this is also get incentivized if a user searches this service?
Yeah, it is a valid UHI transaction.
Okay. Yeah. And
last
small question. Yes,
you
sir.
write a small email in relation to that. We will clarify it separately also. Yeah.
And sir, for scan and pay, in the document it is mentioned that ₹1 per additional transaction the digital solution company will get. So there will be two parties, right? The scan and pay can be initiated from the PHR app, and the HMIs will also entertain that. So it has to be integrated on both the ends. So both the parties will get 1 rupees?
Yeah, 5 rupees to the facility, 1 rupee to the DSC.
But both the parties, right? A PHR can be other company and the HMIs can be other company, digital company.
It will be not PHR app, it will be DSC only. So
The HMIS.
yeah, HMIS. Yeah. PHR is not there. But
Okay.
you are saying that PHR would also work to get integrated with Scan and Pay, but Scan and Pay, we are not rewarding PHR apps. Yeah, that gap is there. The HMIS is getting rewarded, the facility is getting rewarded, but the PHR app is there.
So are we planning, sir?
We'll have to, it's not there in the present policy. So we'll have to take approvals and provide that. Give us to it in writing, we'll see what happens.
Sure, sir. Thank you.
Yeah.
Anybody else wants to ask any question?
I think Atish and Sam have also asked in the chat box on which link we can see how much incentive DSC is eligible for.
This can be checked in the sandbox login itself.
Okay. So Atish, you please see your sandbox module and log in. If you are not able to see, you just send us an email. We will again get back if you.
Sanjay, SACDU, you want to ask a question?
जी मैं पंडित दीनदयाल हॉस्पिटल वाराणसी से बोल रहा हूँ। ये जब आपका मार्च में फरवरी के लास्ट मार्च में गाइडलाइन आया तो उसमें ये लिखा हुआ था कि आपका क्लेम जो है 1 महीने के बाद कर सकते हैं, मतलब 2 महीने के अंदर कर सकते हैं, अदरवाइज नहीं कर सकते हैं। लेकिन हमारा पेमेंट जो है फरवरी में ही किया गया था और सारे नॉकड ऑफ हो गए हैं और अमाउंट भी बड़े हैं और मेहनत भी हम लोगों ने बड़ा किया हुआ है। तो आपकी गाइडलाइन आने से पहले ही हम लोगों ने किया हुआ है और यूसी भी हमने भेजा हुआ है समय पे, फिर भी नॉकड ऑफ हो गया है। तो रिक्वेस्ट यही है कि समय से पेमेंट किया जाए।
एक बार देख
आपने
लेते हैं।
जी सर जी,
एक बार डिटेल्स जो उत्तर प्रदेश के जितने भी हॉस्पिटल्स हैं एक बार उसको चेक कर लेते हैं।
और मोस्टली जैसा सर ने मोहित सर ने बताया कि बड़े हॉस्पिटल हैं उनका पेमेंट है वो बड़े अमाउंट के हैं जो नॉकड ऑफ हो गए हैं और मेहनत भी हम लोगों ने बड़ा किया हुआ है उसमें।
देख लेते हैं।
रिक्वेस्ट यही है कि सर उसका पेमेंट किया जाए सर।
नियम के अनुसार होगा तो एक बार देख लेते हैं संजय जी, फिर
नियम के अनुसार सर है, नियम के अनुसार ही है, जैसा आपका गाइडलाइन है तो उसके पहले ये सब हो गया था।
ठीक है, हम चेक कर लेंगे।
और कोई क्वेश्चन पूछना चाहता है?
सैम ने लिखा है some of our doctors have not claimed their DHIS from Jan 2025. Would they be able to claim their incentives?
नहीं सर, अभी नहीं कर पाएंगे।
अभी सिर्फ मार्च, अप्रैल, मई, जून का कर पाएंगे।
हाँ जी सर, हाँ जी सर।
ओके। Right. Anybody has? I think Maharashtra, many facilities claims are pending before closure of DHIS scheme. Yes, Maharashtra, there are claims which are pending for March, April, May, and June. We will quickly resolve that. Till February, we have done it. Now we have approval. We will resolve that. Yeah.
सर आई थिंक बाकी क्वेश्चंस हम लोगों ने ऑलरेडी कर लिए हैं।
या तभी भी अगर किसी को कोई सवाल है, यू प्लीज सेंड अस एन email and we will also do another webinar shortly, and if there are any questions we will also share there. Meanwhile we will also put this recording on the website so that you can have a look, and also on our YouTube channel, and we will be in touch. So thank you everybody for joining.
Thank you Vikram sir for your time, and thanks to all the participants also for joining our webinar. We'll organize the next webinar very soon, and we'll update you. Thank you so much.
Thank you everyone. Thank you.
Thank you everyone.